Does sleep quality influence pain? Many patients are unaware that poor sleep can increase pain and reduce their stamina to cope with pain the following day. Research shows that sleep disturbances contribute to heightened sensitivity to noxious and non-noxious stimuli, decreased cognitive function, and reduced overall function. Let's see how sleep influences pain. 1. Sleep and pain are bidirectionally linked, creating a cycle that worsens both conditions. 2. Sleep deprivation affects the immune and nervous systems, which in turn may increase inflammation and sensitivity. 3. Poor sleep habits, stress, and irregular sleep schedules further contribute to heightened pain experiences. However, there are effective treatments for the most common sleep disorder, that is insomnia, which patients may not be aware of. And 4. Not all patients experience pain relief from improved sleep, but nonetheless, improving sleep is a contributor to improving life quality and daily function. Therefore, improving sleep in patients with chronic pain is a valid and often realistic and relevant target, and it may improve their capacity to cope with pain. How to explain this relationship to patients? 1. Explain how pain affects sleep. Many people with chronic pain experience disturbed sleep. Pain may make it difficult for them to fall asleep, or it may wake them up during the night. You can help patients by giving them tools to control their pain, such as meditation, breathing exercises, or listening to calming music. Also, you can help them control worries or stressful thinking at nighttime. 2. Promote sleep hygiene by regular sleep schedules, reduced screen exposure before bed, a comfortable sleep environment, and less caffeine and alcohol consumption. 3. Talk to your patients about why they can't sleep. You can ask if they are disturbed by light or sounds, or if they have certain concerns or worries that keep them awake after the first few hours of sleep. 4. Highlight that exercise can positively influence the patient's sleep, but also that intense exercise close to bedtime should be avoided. And 5. Remind your patients with sleep problems that sleep is not something we automatically do, particularly not when in pain. However, they can learn to better manage factors affecting sleep. Additionally, as a professional, you should identify sleep disorders like insomnia or sleep apnea that may require specialized treatment or a healthcare professional. For example, you can ask a patient's partner about nocturnal noises, heavy snoring, etc. Let's put it in practice. Mark is a 42-year-old man with chronic low back pain. He is currently under stress at work, meeting deadlines and often working long hours. To calm down, Mark has a habit of drinking a couple of beers or glasses of wine with late dinners. Likewise, he usually uses his phone in bed to check mails before going to sleep. He struggles with sleep but doesn't see how it connects to his pain. He often wakes up at night to use the bathroom and can take a while to fall asleep again.
Mark, I know you've been frustrated with your back pain. Can we talk about something that might be making it worse?
Sure, but I don't see what else I can do. I've tried different mattresses and nothing helps.
That makes sense. But pain isn't just about your back, it's also about how your body recovers. I noticed you mentioned waking up at night to use the bathroom. Do you think your life habits could be affecting your sleep?
I guess so. I do have a couple of beers before bed, and I'm usually on my phone until I fall asleep.
Both alcohol and screen light can make it harder to get deep, restful sleep. And when your sleep is disrupted, your body has a harder time managing pain. Would you be open to trying some small changes?
Like what?
Maybe swapping the beer for water a couple of nights a week and putting your phone away 30 minutes before bed. These small changes might help you sleep better and reduce your pain.
I never thought about that. I guess it's worth a try.
To sum up, as healthcare professionals, we must recognize sleep as a critical factor in pain management. Educating patients about the impact of sleep on pain, healing, and function can empower them to make meaningful changes.